Welcome to Adapt in Class. There's some few topics that you have to master before you take your NCLEX. And if you're going to take your NCLEX in the next few weeks, I encourage you to watch this video. These are board favorite key concepts that keep on coming back. They keep on repeating it. It's a theme that I've heard from people who are taking this test. It's not all inclusive, but I've taken 40 of them and I've made a question. You would like to look at it. These are concepts you should know before. They are board favorite. 40 of them will be working on test taking strategy and how to answer them. Buckle up and let's go. First question, as usual, prioritization. You have to be sharp. Which of the following clients need a private room? What is the problem? A client with HIV patient and a CD4 count of 500. Bring your content. HIV patient, CD4 count of 500. This is normal person. Is immunocompetent. At the same time, HIV is a standard precaution by CDC. Therefore, it does not need to be isolated. Don't worry about it. Client with what? Buzzword, unencrusted rash on the face and fever for what? 24 hours. What do you think? Buzzword, unencrusted lesion on the face and fever. This is what? Impetigo. What do you do with impetigo? Contact precaution. Client with what? West Nile virus infection and fever. Bring your content. West Nile virus is standard precaution. It's not infectious. Therefore, you don't need a private room. Client with chickenpox, okay, but what? It's been 10 days and the lesions are crusted and covered. Key facts you have to know about chickenpox, right? 2 days before the rash, they are infectious. 6 to 7 days while the rash comes, they're also infectious. After the rash get crusted, not. So at least 9 days, they're infectious, right? But now we have 10 days and we have a crusted lesion. Don't worry about it. And the only person you need a private room, impetigo patient. Test taking strategy. This one, you got to bring it. If you know your ABG, this is the way to test you if you understand your ABG. It's not about finding whether it's acidosis or alkalosis, but how to apply it clinically. You can use it when you go to your ward, but for your test too, you can use it. What is the next best action by the nurse? A nurse is caring for an intubated client with sepsis in the ICU. I have sepsis, I'm in the ICU. The following ABG was obtained. What do we got? At 6 o'clock, we have a pH of 7.25, PCO2 of 35, bicarb of 12, PaO2 of 99, and saturation is 100%. How do I do my ABG? I take my pH and I write 7.4. I take my CO2 and I write what? 40. I take my bicarb and I write 24. CO2 is my respiratory, bicarb is my metabolic. That's all, respiratory and metabolic. If you less than 7.54, you are acidotic. We have 7.4, therefore we are what? Acidosis. And I ask myself, what is causing acidosis? If the CO2 is causing acidosis, it should go up. It has gone down. It's less than 40. Therefore, I know CO2 is not a problem. If bicarb is causing the acidosis, it should go down. It has gone down almost like 12 points. Therefore, I know bicarb is causing the acidosis. And I told you bicarb is metabolic, CO2 is respiratory. Therefore, I have metabolic acidosis. After you finished, you said what compensation, your body will not stay in this state. What compensation is going to happen? How do you find compensation? Take each segment. Acidosis, I put opposite, alkalosis. Metabolic, I put respiratory, alkalosis. Therefore, to compensate, you have to have respiratory alkalosis. What does respiratory alkalosis look like in the ventilator or in the patient? You got to breathe faster. That means get rid of your CO2. So increase your respiratory rate or dilute your CO2. That means increase your tidal volume. This is what we call minute ventilation. So we got to do something to the ventilation of the ventilator, right? We're increasing our respiratory rate. This said decreasing. If you decrease, you make the acidosis worse, so wrong. I'm talking about ventilation. PEEP and FiO2 deal with oxygenation, no ventilation. At the same time, SAT is 100, AO2 of 99. What else do you want to do with the PEEP and FiO2? It's not going to help you. We're dealing with ventilation. Test taking skills. 1, 2, 3 is gone. Therefore, this has to be your answer. We are increasing our tidal volume to dilute the CO2 so that the CO2 will come down probably 25 and the pH will be normal. And that will make the patient happy. So the nurse is supposed to increase the tidal volume. This is how you use the ABG to take care of a patient. If you need more, check at that NCLEX or email me. Take care of yourself. Keep charging as always. Let's keep on going. Another strategy, buzzwords I'm going to use. Select or apply. Which of the following should be what? Anticipated. And then she's caring for a client admitted for what? Anorexia nervosa. I'm taking these three, rewriting my question. I would say, I have anorexia nervosa. What do I expect? Bring your content. They are preoccupied with their weight. Because of the vomiting and the dehydration, they always bradycardia. Their skin is very dry, right? Their BMI is less than 18.5. It cannot be 25. There's no way. This is mild obesity. Anorexian patient cannot be mild obesity. Bulimia, yeah, this can be bulimia patient. If they are female, they may have amenorrhea. And their temperature is always hypothermia. That is normal for them. This is why they have Lanuga to insulate their body. These are primitive features for preterm baby. They have Lanuga to insulate them. So anorexia patient also do the same thing. So those are your answers. 1, 2, 3, 5, and 6. You don't have to pick everything. If you don't know it, leave it. You have to be 100% 101. If you can chew it, don't bite it, okay? That's the key. Bite what you can chew. If you can bite only 3 and you know you can chew it, then do that. But don't take all of them, okay? You get partial credit. Don't worry about getting everything right. Number 4, same thing, right? Select or apply. Which of the following situation instituted by the new graduate need immediate intervention by the preceptor? I need to intervene. This is a priority patient, Bishop. And this is precepting a new graduate. What did she do that we need to intervene? Cirrhosis patient placed in what? Supine position for paracentesis. In paracentesis, I want you to be upright so that I can stick the needle in the dependent position and get the fluid, or upright and lean forward. If you're supine, we have a trouble. So we got to intervene. Meningitis, infection, right? I need some lumbar puncture, right? What do? You put the patient in prone position. This is the patient back. You puncture here. I need to put pressure here to prevent CSF leakage after the procedure. Therefore, you have to stay on your back to put pressure there. Prone position, you're going to leak. TBI, severe brain injury. And your ICP is what? 25. And you are in a supine position. ICP greater than 20 is too high. We got to bring it down. How do you bring it down? Drain the brain out of blood. So you put the patient head up. At least 30 degrees is good. Supine, you're going to increase ICP. 32 weeks pregnant, place in what? Supine position for blood pressure of this. Pregnant lady, hypotensive, never put them in supine. You need to offload from the inferior vena cava of the uterus, offload the uterus of the inferior vena cava. How do you do that? Put them on the left side. The uterus will roll away from the big vein and allow blood to return to the heart, and the blood pressure will be fine. Never put the pregnant lady in the supine position. We got to intervene. Renal mass. Kidney is on your back. And Client is placed in a left lateral position after kidney biopsy. If I biopsy this, the kidney is very vascular. It's going to bleed. You need to put pressure. Since you cannot put your hand there and hold there forever, let the patient lay on their back and they will do their own pressure. If you put them on the left lateral position, they're bleeding. That means all these 5 patients need to be intervened. The new graduate is in trouble. Number 5, same strategy we're using, select or apply. Which of the following the nurse should include in the plan of care, right? 4-year-old, leukemia, okay? Client present to the emergency room with what? Fever, malaise, anorexia. Exams reveal numerous papules and vesicles, weights that are spread from where? From the scalp to the lower extremities per the parent. Bring it on, your content. I have immunocompromised patient, leukemia patient. He has fever, malaise, anorexia. But what is the problem? I see vesicles, and that is spreading so quickly from the head down. I know this patient has varicella infection, chickenpox, right? What do? Chickenpox, you got to act fast. You need what? Contact and airborne. It does not need droplet. Vaccination of the client immediately. Is already infected. It does not need any vaccination anymore. Institute contact precaution. Excellent. Isolate the child at home until crusted and dry vesicles. They are not infectious when the lesions are crusted and dry. So this is good. Calamine lotion for comfort. These lesions are very pruritic. That means it's itchy. Lotion for comfort. It's a viral infection. Stay away from aspirin. Otherwise, they get what? Rage syndrome. Aspirin for fever, negative. No. Administer acyclovir as prescribed. Somebody will figure out, what is this? Look at the last name, VIR. That means it's used for virus. This medication is used is an antiviral. We don't give everybody who have chickenpox antiviral, except if they are immunocompromised. That will shorten the duration of their symptoms, but it does not prevent the infection. It does not stop it. It's shortening the duration. You want to do that for immunocompromised patients so that they don't get severe disease, disseminated disease. Therefore, we give them acyclovir. So the right answer is 3, 4, 5, and 7. Once again, you don't have to pick all of them. If you don't know it, just leave it. You have to be 100% sure to pick that answer. So just make sure you're not guessing. No need to guess. If you don't feel comfortable, don't pick the answer. Okay? I like to give you a lot of select reply to make it comfortable so that in your test, when you see them, you say, it's another question. Which of the following the nurse should anticipate something is bad, right? 6 months old, is a kid, brought into the emergency room. What is the problem? Poor feeding, fever, lethargic, vomiting, a bunch of weight. If you can figure out what is going on, look at it. Assessment reveal bulging fontanelle. Sit back and put the words together. It's a 6 months old. He can eat. He has fever, neurological symptoms, lethargic, be sharp, and I'm vomiting. If that is not enough, I have bulging fontanelle. That should tell you ICP is up. If I have fever, lethargy, poor feeding, and ICP, you know I have meningitis. Therefore, I have meningitis. Vaccination of family members. Yeah, this will prevent recurring. Maybe mother has the infection and give it to the baby. Droplet precaution. That's not droplet, right? Yes, it's droplet precaution. Most of them is Neisseria meningitis, okay? And most of them are droplet precaution. So instituted droplet precaution. They will be in a private room. Decreased stimuli because their ICP is high. Q6 neurological check. Think about it. Test taking skills. I have bulging fontanelle. And then you want to see me every 6 hours, even 4 hours. is routine. 6 hours is not classified as routine. That means basically you just like checking if they're still alive. Well, guess what? This patient need Q1 vitals. So this is wrong. Pathogen specific antibiotic. Yeah, we're going to do lumbar puncture. We find the organism and we give you antibiotics specific to the organism. Therefore, this is right. So 1, 2, 3, and 5 are your right answer. Those are what we're going to institute in this care. Next question, prioritization. You got to be sharp. Immediate intervention. A bunch of same patient, time. I know everybody talk about time. I never talk about time. This is no problem. 24-hour patient can get sick. 8-hour patient can get sick. 48 hours patient, but I just put it there so to tell you time is not a factor, okay? Time is not a factor, right? 12 hours, it does not matter. You can get sick if it's 24 hours. Post-cardiac catheterization, the whole has the cardiac catheterization. If your MAP is 70, it is normal. 65 to 75 is normal. That means you're not bleeding. Your BUN normal is 20, it's 19. That means the urine output is adequate. CVP of 7, central venous pressure, normal is 2 to 8. This guy pressure is normal. Your urine output is 60 ml. Okay, average person is 70 kilos. And you need to have at least 0.5 ml per kilo, which is about 35 ml an hour. Okay, 35. Sometimes we say 30 ml per hour. It's 4 hours. You should be close to 120 to 60 half. Something is wrong. You're bleeding. You're dehydrated. But you can't just be dehydrated after cardiac catheterization. We think about it like blood is coming out. So 4 is the patient that needs to be seen. Number 8. This is the mini case form. I think it's 3 portion, but just to give you some topic you need to know. See the way I'm going to attack it. If you never see me answer a question before in case study, this is the way it's done. Buzzwords, all you care about. 80-year-old, that tell you this is a bad problem in an older patient. You got to pay attention. Was admitted to what? ICU, right? For what? Bilobal pneumonia, for just infection. Then 3 days later, what happened? It does not remember anything, a name, reason for admission. Something is wrong. Acute change. There's what? 1-to-1 SIDA because I'm pulling my IV. I'm confused. She report of something crawling on the skin, hallucination. Put it together. 80-year-old older patient has infection, admitted to the ICU. 3 days later, does not know where she is pulling IV, and is confused and hallucination. What do you think? Just want to confuse you. I put hypertension, hyperlipidemia, and transient ischemic stroke. Transient, right? This is like mini stroke, right? Confuse you. She's on appropriate medication. The vitals is that, slightly tachycardia because she's confused. She's like hyperventilating or something like that. What do you think? What is the client's experiencing? Transient ischemic attack is usually, they will tell you, like a drip is coming in, curtain falling over their eye, they get stroke, they go blind quickly and they come back. It's a mini stroke. I never described that. Dementia is a progressive problem. It's not acute problem. Stroke, I have to talk about fast. No facial drooping, nothing like that. Therefore, what? Delirium, acute change in mental status due to infection, and then hallucination, hallucinating. That's what. These are the key that you have to answer this question. Expect to see a question like that. Whenever they give you delirium, remember they're going to ask you to distinguish between dementia or depression. I got you. Don't worry. Break it down. Same case. Which of these can happen acutely? Delirium, dementia, progressive depression does not happen acutely. Which of these is caused by infection? You know, delirium. Which of these the patient will be hallucinating? Delirium. Memory, you can see this guy, his memory is affected. Dementia, yeah. You have memory problem. That's the definition of that. And depression, their concentration will be affected, so they can affect their memory. Which one is irreversible? You can't fix it. Delirium, if you take away the offending agent, they will be fine. Dementia, yes, it's irreversible. It's a progressive disease. Depression is reversible. This is the way it's supposed to look. If you don't understand this, check adapting, please. But that's how you answer this question. Now, I want you to know, I've given you some of the information. What are the causes of the situation? Which of the following may be the potential cause of the client situation? Other factors that can cause delirium. Your glucose level is low. Patient has pneumonia, is getting antibiotic. Antibiotic don't do that. It's just helping with the infection. There's no way antibiotic will, it does not affect your neurological system. Multiple morphine, yeah. If you are 80-year-old, I keep on slamming you with morphine, yeah, you get confused. Infection, yeah, sensorium is going to be affected. If you're not sleeping, yeah. So these are causes. This is not potential, these are potential. This is another case to show you some of the cases they will give you. This is a case you may not have heard it before, but this is maybe new for you, but this is a good one. If you get it, it's easy. I have you down here. 25-year-old. There's a reason why I put a female in the medical surgical ward. I did not give you anything. I just told you it's in a ward. Now everything is based on physical exam. Expect questions like that. What did I give you? She's very tall, slender, long arms, legs, fingers, and joint upper mobility. These are the people their joint can rotate 360 degrees. It's a problem. Decrease visual acuity because the lens can move around multiple times. They have connective tissue disease, so they have a heart murmur. Their fingers are long, arachnoid, like arachnoid, like spider, yeah. Dactylity, long fingers, joint. Their father have it. So this is a genetic problem, right? The nurse know that the client has what? Put it together. Parkinson, I never tell you they have resting tremor, rigidity, mask-like face. Yeah, it cannot be this. Antitin, look forward. Chorea, like snake movement. Dwarfism, the guy is like he's so tall. How can he be dwarfism? Testicle skills, Marfan syndrome. This is a connective tissue disease where these individuals are long, everything is long, slender, they're very tall. They look like giants, but they have no body fat, very, very tall, lanky. Their hands can go all the way, and their head is like that. This is Marfan syndrome. Okay, it's connective tissue disease. It affects a bunch of staffs. So, therefore, what additional finding will you see? They will have their spine is too long, like they have scoliosis. And their chest wall, the pectus, look like it's coming out. Pectus excavatum. This is not related to steroids, so they don't have asceticism. Their head is not big. You saw the tall structure I drew. There's no way it can hold that weight of the body. So their BMI is very low. So 1, 2 additional finding you see in them. You need to know the complication for this, then you can teach the patient what complication the nurse will anticipate from this. Select or apply. This, I give you all the content you need to know for this. Their retina will detach because of the connective tissue disease. Their lens is not stable. It dislocates all the time. Their vessels can form aneurysm, and this aneurysm can dissect. The bigger problem is when you're a female, we don't want you to get pregnant because of all the blood volume and everything. They will have maternal complication in death. They can die in childbirth. Therefore, this is another issue. Now, what do we have? At discharge, we teaching is a priority. They're going on and it's indicated. What do you tell them? Based on the signs and symptoms and complication I have told you, what do you think? Word routine is never normal when somebody have a problem. Routine means you just whenever we need it. No, this guy lens and retina is going to detach. I want you to schedule eye exams. Don't do a routine eye exams. Schedule it so that I know every 2 hours, every 2 months I'm coming. Reliable contraception to avoid pregnancy. Yeah, barrier method, another thing that will prevent me from getting pregnant. Monitor spine curvature. They get scoliosis. They cannot do any splinter exercise. Otherwise, they will have dissection of the aorta. No contact sports. If somebody bump into you, you're going to rupture stuff. So no contact sports. You can't play soccer. You can't play rugby. You can't play basketball. You can't play football. And you don't want to build muscle. You can't lift any weight. Don't lift weight because you want to build muscle. No, you're going to rupture your aneurysm. We don't want because of the strain that's associated with that. So this patient is wrong. So the right answer is what? 2, 3, 4, 5. 2, 3, 4, 5 are your right answer. So that's what you tell them. The same question. Now you know the problem. We don't want them to rupture the aneurysm and dissection. What do you think? Which prescription the nurse should anticipate to prevent complication? The problem is we want to decrease their blood pressure, and then we want to decrease their heart rate. Which of these medication, you see what I did? Because I know the content. Which of this is better? Aspirin won't do that. Lisinopril will help with the hypertension. Albuterol will increase their heart rate. Beta blocker, yeah, take care of this and that. So number 4, everybody should be on beta blocker for patient with Marfan syndrome. You see, it's not difficult, right? Just break it down with your content. Select or apply. Which of the following the nurse should include in the plan of care? 35-year-old arrived to the orthopedic ward after cervical laminectomy. Fancy word. All it means is I do laminectomy. This is removing the lamina of the cervical spine. If this is the head and there is spine, cervical vertebrae here, they have laminectomy. Or you can turn into what? Spine surgery. There's nerves that go through these lamina and the vertebra. When you have spine surgery, you expect them to get injured. And the cervical region control your hand. Therefore, why don't you check their hand grip? See if there's a nerve injury. We're going to put dressing on it. The biggest problem when you do spine surgery, look for leak of CSF. And how do you see it? It's a clear output. So just see the amount and character is important. The cervical region controls C3, C4, C5. That's the nerve root. And these control your diaphragm. Therefore, I want to see if you can cough. If you're not coughing, I've injured your diaphragm. There is a laryngeal nerve that control your voice and everything. If that is injured, will cause hoarseness. It's in your neck. We want to prevent spine injury after the surgery, so log roll them technique is the way to move them. You don't need to call for paresthesia because it can last for like a week or 2. That's normal. Teach them to move like a unit so that they don't bend their head and neck, and that will prevent the instability of the spine. So teach them that. So 1, 2, 3, 4, 5, 6. 1, 2, 3, 4, 5, 7 are your right answer. 6 is not. The NCLEX will not give you all this so that you guess. I mean, they will give you maybe 2 answers and 7 options so that if you pick more than 3, you get 0. So like I said, if you know the content, pick them. If you don't know, leave it below. Don't pick it. You pick those, you know, you basically you picking those, you know, what you can chew them, you know, you bite what you can chew. If you can't chew it, don't bite it. Okay, I know I can chew it, so I bait all the answer choice because I know the answers. But if you can chew it, don't bite it. That's the key. You don't need to guess. Select or apply. Prioritization, as usual. Immediate intervention. Keywords, right? What is the problem? All of them have digoxin and different ages. 65-year-old on digoxin, magnesium of 2. When you're on digoxin, keep magnesium normal. 7-year-old, digoxin, apical pulse. Yes, it's 70. For a young like that, we want apical pulse to be greater than 70. 72, we're good. 55-year-old, digoxin, level 0.51. We want 0.522 nanogram per minute. This is normal. Test taking skills 4 hours to be there. There's no way you can take a medication and there's a change in your vision. That tells you something is wrong. It's a toxicity. Even if you don't know, when you take any medication that make you see yellow, green, well, that's not a good medication. Something is not right. That's not what it's made for. Therefore, I'm picking number 5. This is a toxicity. Yellow, green vision is a toxicity. Don't call your ophthalmology. Call your doctor right away. It's telling you something is wrong. Number 18, test taking skills. Which of the following is indicated? Client with reflux is taking omeprazole for 2 years. Anybody who take a medication for that long, we call it chronic. It takes you for a long time. What is omeprazole? It's a PPI. When you take PPI, 3 things: pneumonia, okay, C. diff, osteoporosis. These are the complications. Therefore, you watch for that. When they have diarrhea, C. diff, B-sharp movement. When they have osteoporosis, you got to teach them to prevent osteoporosis. High fiber diet, it does not answer my content here. Low sodium is indicated, not indicated. When you're on a PPI, you shouldn't be taking Nesium, You need to be taking ibuprofen. That will make you bleed and you develop ulcer, right? I did not give you calcium. Otherwise, that will give you the answer choice away because you think osteoporosis. I want you to take vitamin D. You need vitamin D to absorb calcium, but you don't need calcium to absorb vitamin D. So vitamin D supplement will help with your calcium absorption. So this patient needs calcium to prevent osteoporosis, and vitamin D supplement will help with that. Strategy, key concept, make you think question. 19, same question here, same thinking. Which of the following the nurse should anticipate as part of the what? Treatment plan. Select or apply. Client with what? That's a scan of T-square of this. Negative 2.5. You have to know this number. What's prescribed? What? Calcium. Even if you don't know, I've given you a clue here. Buzzword. 3 months later, what happened? I'm straining in the bathroom. I'm spending 20 minutes on the toilet, and I have difficulty emptying, and I can't have bowel movement every day. Think about it. I start taking calcium because my T-score is less than 2.5, and I'm having all these problems. Look at what I'm going to do. 2.5 means I have osteoporosis, less than 2.5. What do we give you? Calcium. I give you calcium, you have bowel problem. What have happened? Constipation. Question is asking you, how do you manage constipation? All these 6 lines, you see what I did? Management of constipation. I don't want you to take laxative. It does not help you. I want you to go natural. High fiber diet. Excellent. 1 liter of water a day is not enough. I need you to do 2 to 3 liters a day. Moderate exercise. Excellent. Avoid whole grain, what? Bread. No, I want you to eat them, not white bread. So 2 and 4 are your right answer. Good question. That requires a lot of thinking, but I know you can get it done. Number 20. Which of the following the nurse should expect or not expect? Not expected, right? A client with what? Severe TBI, bad brain injury, involved in motor vehicle accident, in the ICU. 24 hours. Urine was charted as what? Clear, and 6 liters. Who pee 6 liters? And it's clear, and I have TBI. Look at what I've done. I just wrote down the buzzword. Brain injury 6 liters, 12 urine 24 hours. I mean, DI. If I'm DI, that means I'm peeing water. My urine is just water. Therefore, if I check the sodium level, it's going to be low. If I'm peeing all my water, my serum, my blood is going to get concentrated. My serum sodium is going to be high. Urine specific gravity is 1.003 to 1.030. If I'm in DI and my urine is so diluted, my specific gravity should be less than 1.003. This is 1.030. That means it's normal. It's not expected. If I'm peeing a lot of urine and fluid lost, my serum should be concentrated. Osmolarity of 300 is too high. It's usually normal, it's like 285. Seizure, you get seizure when your sodium is low. In the serum, our sodium is high, therefore it's not indicated. This is endocrine. If you have a problem, check my YouTube and you will love it. Trust me, you can't find this in YouTube. This is key stuff that will make you comfortable, pass your exams, and be more comfortable answering questions. When you know the content, this is just like, okay, yeah, let's go, bring it on. Okay, so keep charging as always. Never stop charging. Next question. Which of the following action is a priority? Select or apply. What do you think? The client with what? DVT was placed on what? Heparin drip. 1 hour PTT was 150. Client was noted to be what? Bleeding from all IV sites, including the nose. Think about it. That's what DVT. I'm on heparin. My PTT is 150. It's double, almost triple what I needed. You're going to bleed. I'm bleeding. What will you do? Priority. That's what I've rewrite the question. DVT, PTT too high. What am I going to do? Select or apply. You're going to lower the drip and keep it going. Do PTT of that. Whenever you give somebody poison and they're getting sick, stop it. Don't lower it. Don't decrease it. Take it, stop it. Well, send a CBC to see how much they have bled. Stop the heparin drip. Excellent. This is a trap. Give vitamin K immediately. This is used for Coumadin or Warfarin. Administer magnesium sulfate. No, it's a trap. It's protamine sulfate. It's not magnesium sulfate. Protamine sulfate is for heparin. So 2 and 3 are your right answer. That's all. That's all you need. Okay. Really hard question, but I require you to think. 22. What do we have? Select or apply. Which of the following the next should include? I need to include it. And next is teaching new graduate on the characteristics of a child abuser. Who, when we find information about them, how do we know they are child abuser? They have unrealistic expectation from the kids, so unrealistic from the parents, right? They have unrealistic expectation. That's what they do. Use of what? Substance abuse. Yeah. What do you think? History of what? Domestic violence. Yeah. They have low self-esteem and they've been abused before. They basically expecting so much, so they have unrealistic expectation. That's the parent attitude, and they do all these things. So these are the features for these that you can find. But this can be stereotypical. Not everybody is like that, but this is the few that they like to emphasize that we can generalize on. Number 23. Which information below in the caring nurse incident report? That means you wrote incident report, require further teaching from the child nurse. The client fell and broke the hip. A bunch of words, just rewrite it. Client basically had hip fracture. Something in the incident report that is wrong that we got to intercede. or intervene. Incident report has to be factual. It's objective, nothing about subjective. Don't give your opinion on nothing. That's all. And witness information need to be stated. Mr. K fell at 3 p.m. and broke the hip. That's fine. This is all factual. Mr. K said, I stepped on the gloves on the floor and fell. You put his statement in. He's the patient. He said, this is what happened. This is what happened to me. Mr. K fell because of his unsteadiness due to prior stroke. How do you know? There's no reason you have to say because. You shouldn't do that. So this is a suspect. Mr. B, client's roommate, said, I heard the loud sound and saw him fall. That's what he saw, and he's telling you. It's all factual information. So 3 need further teaching from the charge nurse to tell them, you can't say that. It's not your opinion. Just write it and send it to the hospital management care, and they will figure it out. Number 24. What do we have? Select or apply. Which of the following the nurse should expect? An expected finding. A client was delivered 43 weeks due to polyhydramnios, right? The client arrived at the nursery for assessment. Which of the following you should expect? Look at what I'm going to say. 43 weeks, I was born. What am I going to see? Expected finding. Rewrite the buzzword, case study, and this is the way I put it. 42 weeks, I would say I'm grown human now. I'm no more a baby. I have features of what? An adult. Undescended testicles, no. Sometimes you can get kids whose testicles are undescended, but 95%, 99% of the kids, when they're born, their testicles are term, which is what? 37 weeks. Their testicles is descended, unless something happens. If you're 43 weeks, oh, come on, it's already way down. So undescended, I don't expect that. Single anterior transverse crease on your sole. They will have like multiple crease. So this is not an adult features. Fine dry hair on the back and the shoulder. What do you think? They will have fine dry hair on their back and the shoulder. They're looking like adult now. This is like, yeah, adult features. Green, brown, yellow stain of the skin. They may have passed meconium while they are in utero. So you see green stuff on their body. Long finger and toenail, yeah, like an adult, right? Large amount of venous caseosa on the skin. These are the white thing you see on the baby. And when they're born, at term, they usually start to go down. By the time they post them, there shouldn't be any more. So they shouldn't be large. It should be, say, decrease. So decrease amount of venous caseosa. So this is not expected. So 3, 4, and 5 are your right answers. This question is a little bit harder. Okay, let's try this if we can. Maybe this may be better. I can tell that this is also required thinking. Which of the following assessment the nurse should expect or not expect? A nurse measure a client's central venous pressure of 20. Bring it on. When you see short questions like that, put the facts together. CVP of 20. What does it tell me? You say, what is normal CVP? It's 2 to 8. 20 is almost 3 times. And CVP tell you your fluid status. That means I'm fluid overloaded 3 times. All I'm asking you is fluid overloaded. Rewrite the question. What do you see when somebody is fluid overloaded? Yeah. Periorbital, edema, right? That's no brainer. Skin tinting, no, it's going to be really turgid. Really, it's not going to be tinting. That's not expected. Their pulse is not going to be thready. It's going to be bounding, right? Their skin is not going to be cold. They're not going to be hypotensive. Their capillary refill will be what? The purposes, the pulse, it's so burning that it could be less than 2 centimeters. They're not dry. Their lung will sound crackled. So this is fluid deficit. You have to master this information. fluid deficit, and fluid overloaded information. Okay. So that's that question. Number 26. What do we have? What is the next best action? A client with DNR order is intubated in an ICU for respiratory failure. The monitor suddenly showed asystole. The wife pushed the cat in the room and said to the nurse, please do something. If I said, do not resuscitate, and I'm dying, don't touch me, let me die. Calling a code is a violation. CPR is a trap. Honor their wishes. Don't attach any defibrillator. He said, do not resuscitate. You got to follow orders. Straightforward. No comment on that. Next one, 27. Which of the following client a consent obtained from the client the nurse should consider question? What do you think? I will have to question that. Okay? Or you can just remove the consider should question that. Which of these should you question? That means you're not supposed to give consent. That's all. 16-year-old army sergeant, if you can go and die, you can consent for your appendicitis. 15-year-old alcohol rehabilitation, they allow for drug abuse, treatment, STDs, or oral contraception. They can do that without consent. 14-year-old STD, you can do whatever you want to do. 16-year-old, you can't consent. This is a routine problem. So your mother has to be there. But STD treatment, rehabilitation for drug, yeah, you don't need consent, even if you are minor. Minor is less than 18. You need consent for most procedures if you're less than 18. But there's certain situation they allow. You are army, you are in the military, you're getting alcohol treatment, you're getting STD treatment or oral contraception, you don't need consent. Or if you emancipated, you married, you have a baby, and you're financially independent, yeah, you can do it on your own. Number 28, select or apply. Which of the following is a risk factor for breast cancer? You have to know this in case they ask you. This is health maintenance, right? 35-year-old female client was evaluated in a breast clinic. Which one? It's a breast cancer. The way to make it easy for you if you don't know anything about breast cancer is estrogen exposure. That means if you have too much estrogen in your system, you're more likely to get breast cancer. That's all. That's the way to think about it. Pregnancy is protective. Whenever you get pregnant, there's no more exposure of estrogen. How? Because you're not having menses for 12 months or 9 months minimum. When you are not getting your menses, that means you are not being exposed to estrogen level to stimulate your breast and your urine area. That means, yeah. So pregnancy is protective for breast cancer. So you should have more babies. I'm joking. Yeah. Pregnancy is protective. So yes. Age, yeah. The older you are, the more you're likely to have breast cancer. Menarche at 11. If you have your first menses less than 12 years old, yeah, you end up being exposed to estrogen for a long time. So early menarche is bad. So less 11-year-old is early menarche. That means your duration to the exposure of estrogen is high. And late menopause, okay, late menopause is greater than 55. That means you have also exposure of estrogen. If there's a family history of breast cancer, yeah. Dense breast is also a problem because we cannot examine you appropriately. We can mix things. Fibroadenoma is not a risk factor. It's just a fatty tissue of your breast. Okay, so 1 to 6 are the risk factors for breast cancer. Number 29, select or apply. Which of the following the nurse should include in the plan of care, right? 35-year-old client arrived to the ortho ward after cast placement. I put the cast in your leg because you have what? Tib fib fracture, right? Tib fib fracture. You have to be comfortable with this cast, right? Teaching. Instruct the client to perform active range of motion. Yes, I want you to do that. 10 clients side to side using fingers Q2 hours to help dry the first 72 hours. Yes, you want to turn them the first 72 hours to help dry the cast, but don't use your finger because it creates indentation. Use the palm. So this should not be included in the treatment. Cover the cast with blanket for 12 hours. No, we want air to go there and dry it. So no extended period of cast being covered. No. Apply ice directly over the fracture site first 24 hours. Yes, I want you to apply ice over the fracture site 24 hours, but not directly over it. It will make the cast worse. You have to put it in the plastic or cover the ice and place whatever you've used to cover it on the skin, but not the ice directly on the skin. So this is wrong. Elevate the extremities for 72 hours above the level of the heart. No, just 24 hours. Elevate it 24 hours. This was designed to like trick you. I use words that are correct, but then I change one few words. Only 24 hours for elevation. So what is the right answer? 1. If you choose 1 and 2, you get 0. This was intentionally said to tell you that they can make this like that and only 1 answer choice. So if you're confident, you just pick 1 because that's what you can choose. So you buy it. Number 30. Like I told you, these are concepts you have to know that keep on coming and back. So if you know this, you go in. This is you got to stop, answer it, and see what I say. These are topics that keep on coming back multiple times based on things I've heard from people. Which client situation need immediate intervention? I'm on Coumadin for DVT, INR of 2. Excellent. That's where I want you to be. Right? I'm on Coumadin, DVT, and PT. Right? The PT is what, 26 seconds. That's where I want you to be. I'm on Coumadin, DVT, with INR of 1, and my PTT is 60 on heparin. This is to tell you that when you're on Coumadin, we bridge you with heparin. The individual PTT is therapeutic, but the INR is not, so we can continue. Sometimes we wait until your INR is like 1.5 and then stop the heparin. So this is fine. Test taking skills. Number 4 has to be your answer. Coumadin for DVT, now avoiding leafy vegetables. This is always a trap. Leafy vegetables control vitamin K, right? Yes, vitamin K. Key fact, when you're on Coumadin, never change how much vitamin K you're taking. Take the same amount, don't decrease it, don't go up on it. Just take the same amount. So this patient, we got to intervene. Number 31. What do we have? Select or apply. Which of the following teaching the nurse should include at discharge? A nurse is caring for a client with what? Asthma. If taking theophylline was added to the medication for better control, which of this you should include? Buzzword, theophylline. When you're taking theophylline, this medication, the therapeutic is 10 to 20. It's high maintenance. It has a lot of side effects with the seizures and cardiac arrhythmia. You need to teach them to prevent that. How? According to 4C. 4C, 1C, caffeine. Absolutely, don't take caffeine. 1 to 2 cups, I don't want it. Cimetidine, second C. You should not use cimetidine for good. Use another medication. Moderate alcohol. Third C, consumption, right? This affects the liver, cirrhosis. You should not drink alcohol at all. Avoid any hepatotoxic drug. Yes, because the third C is cirrhosis. And ciprofloxacin in the 4C, don't use it for UTI. Therefore, use this is wrong, this and that. So the only answer choice is number 4. 4C is for theophylline. And this is to trap you. Only one answer choice is right. Okay. Number 32. Which of the following the nurse should anticipate? Select or apply. A nurse is caring for a client with what? Moderate Alzheimer's disease. I have a YouTube short video, very 1 minute, that has all the things I'm about to say. It gives you the different classes of Alzheimer's, mild, moderate, and severe, and how to manage them. You should watch that. What should you expect in a moderate Alzheimer's disease? Straightforward, key fact. You don't have to worry. They have ADL problem. And they become really agitated. Neuropsychotic behavior, depression, anxiety, agitation, confusion, and they're causing problem. Behavior changes. Because of that, you got to follow them slowly. Need close supervision. When they don't recognize things and other people, this has become severe. When their memory becomes fragmented, this is also severe. So moderate is 1 to 3 is your answer. But watch the YouTube short. He has all the information there. 33. What do we have? Which of the following following is the next priority action for the client who is not interested in filing a report? What is the problem? The client presents to the emergency room with multiple injuries sustained from intimate partner violence, IPV. Which of these you should do if the patient said, I'm not going to report it? Document the physical exams finding. Yeah, she's going to get beat again, even though this is important. Let's see if there's another one better. Provide information about supporting group. That's fine. Let's see if that's better. Educate them about stress management. That's fine. Let's see if something is better. Whenever they come in, number 1 is safety. So which of these provides safety? Safe house and shelters, so that they can run from their house in case something happens. This does not provide them safety. So number 4 is a better choice. Provide safety for them. This is a follow-up question. Select other part. Which of the following statement the nurse should intervene when made by the new graduate? A nurse is providing teaching to new graduate about intimate partner violence, IPV. So which one you should know about? IPV works during pregnancy. Yes. It does not affect only women, so we got to intervene. IPV works when one partner threatens to leave. Yes. IPV in an IPV event, client safety is my priority. Yes. In IPV event, I must follow hospital policy of reporting. Yes. So the only one that I need intervention is number 2. It affects both men and women, and no race. It does not see color, race, gender. It affects everybody. This is another topic. It can be a 6 case, but I give you a short one to see if you can figure it out, what is going on. A nurse is caring for a 72-year-old. This because this is where we do this test. Old neonate with new diagnosis of what? Phenylketonuria. That means PKU. You know PKU? Yeah, they have phenylalanin problem. They cannot break that phenylalanin to what? Tyrosine. So they should avoid diet that has a lot of phenylalanin for the rest of their life. Which of the following the nurse should expect? We do this after birth, and it should be done after 48 hours, but before 1 week. So 72 hours is fine. We test it. And when we do that, if they have this problem, this is what we see, fair skin. Fair skin is because of this lack of thyroxine level. So this is good. They will have this musty body, musty urine because of the buildup of the phenylalanin. Everything is up in this patient. That's another word. Their reflexes is high. The activity level is high. They may have seizures, but they are not hypotonia. So this is wrong. 5 and 6 is right. So 1, 2, 3, 5, and 6. They are hypertonia. Everything is up in them, including the skin lesions. They should have specialized food and a formula, and they should prevent phenylaniline the rest of their life in their diet. Number 36. What do we have? What is the appropriate response from the nurse? The nurse is caring for a 2-year-old client diagnosed with what? Epiglottitis. The mother asked the nurse if she should be blamed from this problem. Be therapeutic. Don't be mad. Just be therapeutic. Why do you refuse to vaccinate the child? Why question? Wrong. He's not going to answer. It's confrontative. I will have taken different approach regarding the vaccination. No, answer the question. Who cares what approach you will? She said, am I going to be blamed? Answer the question. Absolutely. You should say, absolutely. You are at fault, but it is too late. Not being helpful. Vaccination could have prevented the illness, but let's focus on and get your child better. So this is much better, right? Number 4 is much. The 37. What do we have? A nurse is caring for a client diagnosed with what? Macular degeneration. Which of the following teaching is indicated or not indicated, right? What do you see? Macular degeneration, if this is the eyes, they lose central vision, okay? Peripheral vision is intact. It become a problem. They can't drive, they can't see well. So that is a problem. Because of that, we don't want them to completely lose the exams. They need to have scheduled high exams regularly. They need to have corrective lenses. We want them to stop driving because it's a safety problem. They should not avoid public transportation. That's best for them. That's the safety net. Because they have macular degeneration. It's due to what? Hypertension and vascular problems. So they should be taking the metro. Ensure prints are large so that they can see better on their prescription. They should avoid tobacco because tobacco is a risk factor. Minimize vitamin C and E. They should take an antioxidants, basically. And C and E is an antioxidant. They should not minimize it. They should take a bunch of it. So those they should indicated are 1, 2, 4, and 5, and 3, and they should not avoid public transportation. It should take a lot of vitamin C and E. Control their blood pressure too. Okay. Number 38. A nurse is caring for a client prescribed what? Risedronate due to osteopenia. I'll tell you what it's used for. Which of the following teaching is indicated or not? You should be familiar with this drug. This is what? Bisphosphonate. There's certain things you should do about this medication that you should know code. Okay, very, very cold. Bisphosphonate. We use it to in patients who have osteoporosis, osteopenia. And the way they will ask you is, how do you take this medication? Because he has a lot of information you need to know. Take the medication with food in the morning. Yes, in the morning, but no food. Therefore, yeah. Remain supine for 30 minutes. No, remain upright for 30 minutes because it causes esophagitis. So remain supine for 30 minutes after the medication is run. Remain upright. Take the medication with full glass of water. Yes, to prevent esophagitis. Take the medication together with calcium. Calcium affects absorption of it, so don't do that. Take the medication at bedtime. You have to remain upright. So if you take it at bedtime, you're going to sleep. So it's not good. Take medication with orange juice. Never do that. And of course, antacid is always bad. Take medication with antacid. It's not good. So only one answer. The rest are not indicated. You see, if you pick more than one, yeah, not good. So 39. 55-year-old client was prescribed. You see, look the same as the drone, but look at the last name, Risedronate. This one is what? Raloxifene. Raloxifene. The Cephen. You can use the Cephen as their last name or the fen as their last name. These are different. This is estrogen and selective estrogen receptor modulator. We call them, it's like tamoxifen, tamoxifen. They are the same thing. They do the same thing, but these are specific. Selective estrogen receptor modulated. I mean, they bind to specific estrogen receptor to help with certain things. 55-year-old is post-menopausal. We use this medication to prevent osteoporosis in older patients who are post-menopausal. Because of that, it blocks estrogen effect and it destroys it in certain organs, and therefore it can exacerbate your hot flashes. The medication will help slow down your bone, it break down bones. So older patient, we give it them. It's different from the dronate, alendronate, that's bisphosphonate. This is an estrogen component that, but it's also help with osteoporosis and bone breakdown. It can also help with your cholesterol. So it affects the bone, it affects the fat, it affects your breast, it affects your uterus. So it prevents bone breakdown, it decreases your cholesterol, it prevents breast cancer, it does not make you bleed, right? Stop the medication before surgery. Why? It causes DVT. That's the biggest problem. Therefore, if you smoke, we don't give it to you. Avoid prolonged immobility because it causes DVT. You may take the medication with food. You must. This is wrong. Pay attention. The dronate, alendronate, the bisphosphonate, you should not take it with food. These cephains, they can take it either plus food or no food. So this is wrong. Must is wrong. Need Q6. We got to check your bone scan and make sure your bone scan is better. Medication can prevent breast cancer. Yeah. So 1, 2, 3, 4, 5, and 7 and 8. 6 is the wrong answer. Pay attention to the name. And the last question, of course, select or apply. You can't do this without a lithium question. 35-year-old female client with bipolar was admitted for what? Maniac episode. Which of the following is indicated? I'm in mania. I'm a bipolar. You got to control me. How do you control me? Set some limits. Let me rest. Give me a calorie because I've been using all my energy. But if you give me food, I have to sit down and eat with a spoon. I'm not eating. So you give them high calorie, ready to go, like hamburgers, burritos, milkshake. They need antipsychotic. We use second generation antipsychotic. If there's no lithium, and then we use a mood stabilizer in place of lithium. So valproic acid. So all of this is indicated. This is it. How did it go? Please, if you don't subscribe, look down, adapt and click and support this channel as much as you can so that we can get more people like you who's watching this video to pass this exam. That's all I care about. So keep charging, never stop charging. Thank you for sticking around. I hope I met your expectation. 40 question, high yield fact, passwords, test taking skills. All the best of luck. And see you later.